Hello, I'm Tony DeMaria, the editor of JACC, here with the highlights of the November 6th issue. Previous data from the Heart Failure Action Study, a study directed to define the role of exercise training in patients with heart failure, showed that exercise training in fact was beneficial in patients with heart failure. Now, these same investigators come back in a new article in JACC and ask the question of how much exercise. Is there a relationship between the amount of exercise and the benefit seen in heart failure patients? So they went back to the Action Heart Failure database and examined this question and came up with a curious finding, and that is that the benefit of exercise training increased at moderate levels of exertion. That is to say, as compared to no exercise training at a level of 3 to 5 METs or 5 to 7 METs progressively reduced the risk of events. However, when one over 7 METs of exertional effort, in fact, there was a blunting of the benefit. Now, why this should happen, this so-called J-curve, is not clear, but one obvious factor was that the benefit achieved was closely correlated with maximal VO2, and maximal VO2 was clearly highest in those patients who were able to exercise to greater than 7 METs per week. So the take-home message from this study: exercise training, particularly at moderate levels, is clearly of benefit in patients with heart failure. However, we probably shouldn't encourage them to overdo it. Now, renal artery denervation has come on the scene as an effective way to treat hypertension, particularly resistant hypertension, and there's no question that it's very capable of lowering blood pressure. However, there haven't been data about whether or not it can affect central hemodynamics and arterial stiffness. So a group of investigators from Germany studied over 100 patients followed for 6 months after renal artery denervation, and they performed radial artery applanation tonometry and did pulse wave analysis in these patients to look at central hemodynamics and aortic stiffness, arterial stiffness. What they found was, in fact, after renal artery denervation, there was a substantial improvement in both. There was a reduction in aortic augmentation index. There was a reduction into carotid femoral pulse wave velocity time, and there was a decrease in ejection time in the central aorta. So these are the first data that provide evidence that renal artery denervation can not only reduce the blood pressure, but also create really beneficial effects on arterial stiffness and central hemodynamics. There's an increasing appreciation that aortic stenosis isn't merely a degenerative disease, but that there's an active inflammatory and degenerative process actually comparable in some ways to atherosclerosis and an increase in calcification. And to study this further, a group of investigators from the Mayo Clinic studied circulating osteogenic endothelial progenitor cells in patients with aortic stenosis. And what they did was they divided their patients into patients with mild to moderate calcific aortic stenosis, severe heavily calcified aortic stenosis, and severe aortic stenosis with coronary artery disease. They then drew blood and looked for circulating endothelial progenitor cells with an osteoblastic phenotype, that is, cells that had osteocalcin as a surface marker, in addition to the typical surface markers for endothelial progenitor cells. And what they found was that there was an increase in the circulating endothelial progenitor cells with an osteoblastic phenotype in patients with heavily calcified aortic stenosis. And in fact, they were able to find evidence of these cells on histologic examination of explanted valves. So additional data in terms of the process of aortic stenosis and perhaps the mechanism by which aortic valves become calcified in the setting of aortic stenosis. In addition, these endothelial progenitor cells with an osteoblastic phenotype may present a marker of the prognosis of patients with aortic stenosis. So a novel observation, and one that may prove not only pathophysiologically but clinically useful. I hope this brief review of the highlights of some of the articles in the November 6th issue of JACC make you want to get to that journal as soon as possible.